There is no widely accepted definition of a predatory publisher or journal. However, there are common characteristics that would lead one to suspect less than scrupulous publishing practices. It is likely you're familiar with the term predatory publishing, but do you closely examine a publisher's integrity when submitting your scientific work to a less well-known journal? Hi, my name is Jonathan Leung, and I'm a clinical pharmacist at Mayo Clinic, Rochester, Minnesota. In our commentary titled Predatory Journals, A Cautionary Tale, and a Lesson in Copyright Transfer, we present a situation in which a trainee inadvertently submitted a manuscript to a journal with predatory practices. Following the submission to this journal, the peer review was completed in just a matter of days by 4 reviewers, but with minimal comments totaling no more than 400 words. This mistake was realized when the mentor was asked by the mentee, "Now how do I pay for this $1,800 publishing fee?" Evaluating the situation, it was quickly realized by the mentor the journal in question had a very similar name as compared to a more well-known journal. Multiple attempts to withdraw the manuscript from the journal were met with non-responsiveness. And when the editorial office finally replied, they refused to allow the manuscript to be withdrawn unless a fine or a fee was paid. The senior author then corresponded with copyright agents for Mayo Clinic, who helped to further assist in withdrawing the manuscript from this journal. Resistance was still met, but a discount to withdraw was offered at a discounted rate. After much time, a final communication to the Predatory Journal's editorial office offered a chance for them to discuss this matter further with our institution's legal department, at which point the manuscript was finally released, but after much time. It is fortunate in our case that no copyright transfer was signed, and as the authors were employed by Mayo Clinic at the time of the manuscript preparation, the copyright was owned by the institution. Thus, this case also highlights the importance of understanding the implications of agreeing to copyright transfer. Our story is unfortunate, but luckily ended in the release of our manuscript and publication elsewhere. Our story is also an important opportunity to review several characteristics consistent with predatory publishing. This includes several factors that was seen in our situation, including journal names that are similar to reputable journals, low-budget websites with grammatical errors, editor names that are not recognizable in the field of interest. There's other factors such as the promise of prompt publication times, or no formal online submission process, so submitting a manuscript directly to an email. There's other factors such as requiring submission fees regardless of acceptance, advertising open access, that's difficult to find fees, or they might be missing from the website, mandating copyright transfer, or they don't discuss copyright transfer at all, the absence of retraction policies following submission, and several other factors that are outlined within our case. Finally, as it relates to education, there is a professional responsibility to ensure that all trainees are knowledgeable of predatory publishing. One avenue to help educate others is through the website called thinkchecksubmit.org. This is an online resource designated to help scholars identify trusted journals and assess a journal for potential predatory characteristics using a systematic checklist. If tools or resources such as thinkchecksubmit.org are not used, being able to identify common predatory characteristics that are highlighted in our commentary is crucial to avoid falling victim to predatory publishers. Thank you for your attention. I hope our cautionary tale will save you from the challenging experience we had with our brush with a predatory publisher.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.